So this was another retrospective analysis where we were curious, about how glycemic control impacts some of the outcomes following mechanical thrombectomy for acute ischemic stroke patients, obviously with large vessel occlusion. There's been prior studies that have demonstrated poor glycemic control, hyperglycemia, or history of diabetes, however you want to phrase it, to impact specifically hemorrhagic transformation, as well as other clinical outcomes like mortality and poor functional independence. So one of the questions I had in my mind and what wasn't clear from the literature is how these outcomes may vary depending on the extent of how poor that glycemic control is. I think most studies have kind of looked at kind of a binary history of diabetes or blood glucose at presentation, but we wanted to look at kind of like how glycemic control for the last 3 months as a surrogate marker, A1C at presentation, impacts these outcomes specifically. And so we looked in our endovascular database. I believe there were 657 patients that that were analyzed, most of them falling into that good glycemic control cohort. So essentially we divided the data between 3 cohorts, looking at patients with quote unquote good glycemic control, which was less than A1C of 6.5. We sort of use that cohort as a control for comparing those patients with worse glycemic control. So the second cohort was those with an A1C between 6.5 and 8. I believe 72 patients fell into that range. And then the third cohort was those with, poor or very poor glycemic control with an A1C greater than 8. Essentially, we found that, and then, the other aspect of this is that in our cohorts, it didn't vary significantly as far as their baseline characteristics, age, NIH stroke scale, other comorbidities. And then importantly, it didn't vary in terms of which patients were offered thrombolysis, on presentation, or who were taking an oral anticoagulant, as those are kind of obvious risk factors for hemorrhagic transformation. But one of the interesting findings is that, we didn't see a clear influence on hemorrhagic transformation, just the history of diabetes or an A1C, all those greater than 6.5. However, when we kind of stratified it and looked at that very poor glycemic control, that's where we saw the impact on hemorrhagic transformation rates. So we found that those with an A1C greater than 8 at presentation were certainly at risk with an odds ratio of around 1.8 for imaging evidence of HT or hemorrhagic transformation.